So Don, thanks for joining me today. I know you've got this new book coming out, and I wanted to talk a little bit about it, find out what the focus of the book is, what you think the impact is going to be. So let me start with, why this book, why now?
Well, we sort of, I'll give you a bit of a backstory on my experience. I was getting ready to fly back from Asia in January of 2020, when all of a sudden flights were starting to be canceled. And the next thing I knew, I had to be rerouted up through Tokyo and finally got in on one of the later flights that came into the US before we all shut down. And it turns out that it was COVID was making its way through the system, and they pretty much shut down entry into the US not too long after I made it back. So the thing that my colleagues and I, Cliff Shultz and Sirgy, started to think about right away was what's the impact on this going to be for countries, but also on markets and just the whole system. The work that we've been doing for a while has been looking at macro marketing systems, and macro marketing systems really examine how things interface. So you've got a lot of the elements of societal side of things and quality of life issues, but also you've got these catalytic institutions that provide services and system support for everything from healthcare through to consumer goods, et cetera. So long story is that we started to think about what's COVID doing to the systems, and not just to our system, but systems from around the world. And so that's kind of the genesis of this book. And in fact, the name of the book, Community Economy and COVID-19, Lessons from Multi-Country Analyses of a Global Pandemic.
Did you sense on that flight when this was happening that it was going to be as big and last as long as it ended up?
Not really. I mean, we didn't really understand it until we got back. I was flying through bird flu. I was flying through all of that. No, we didn't really expect it. I mean, if you think about the subsequent pandemic that hit on, I mean, this is historic proportions.
Well, we hope once in a lifetime.
Yeah,
anyway.
and
I suspect it's not going to be, and I suspect that might. Is that something that becomes evident in your book, that this is not going to be a once in a lifetime occurrence?
Yeah, well, several of the people and the authors provide sort of a forever virus pandemic idea, or it becomes an endemic, but we're going to have to live with it in different forms. And really, I mean, not since the Spanish flu, shall we call it, post-World War I, where everybody had been involved in a global conflict, and the spread of the Spanish flu is kind of consistent with the global nature of a pandemic.
Of course, during that pandemic, had World War I been not occurring, there probably wouldn't have been the worldwide spread, because unlike today, where we have such a mobile, global, interconnected economy and community, that the spread of a virus is it happens fast and it's easy. Yep. Back then, it took a worldwide conflict to spread the virus, I would imagine.
Yeah, but at the same time, as a student of history myself, that if you go back into history, several events really are tied to pandemics, and the trade routes, the Muslim trade routes pulled back in the plague because they didn't want to interact with Europe. So it actually allowed Europe to rise into the trade routes, and the Muslim traders that were coming from the Far East or the Middle East, and the Chinese traders kind of said, wait a minute, we're not going to interact with them. But the plague of trade is kind of it's a historic connection. So we see it going back a long time ago. So, I mean, when we look at right now, as of yesterday, because I looked this one up, there's been 237,655,302 confirmed cases, but those numbers are way low, especially in developing countries. We think it's much, much higher. Deaths have been almost 5 million, And this is all from the World Health Organization. So economic costs, what we're looking at, estimates are that we're going to be probably more than 10 trillion US, and that we're going to see continued impact for quite a while. But
one of the things that you said to me when we were talking about the book previously and getting prepared to have this conversation is, you've no doubt that a litany of books are going to start to come out. So what do you think is unique and most interesting about this book at this point?
The real contribution, and again, back to my co-authors, Cliff Shultz and Joe Sirgy and I, we sat around and sort of thought of how can we look at the system's impact? And how do you really understand systems that operate in different cultures, different places, in different economic states? And we sort of thought to ourselves, well, we've been, and I travel a lot, as does Cliff and Joe, but we said nobody really understands a system or a culture except those that exist within it. So we have a fairly good network around the world, and we thought we would contact a number of our colleagues in universities and in businesses around the world and see if they would be interested in sort of giving us their take on some of the things that have happened in this pandemic and its impact on society, quality of life, and community well-being, but also the business system as well. The difficulty that you can imagine when you're talking about countries from all over the world is how do we kind of group them together, and how do we provide some sort of systematic way to analyze things? And previously in 2017, we had written an article and a chapter in a book on community well-being and flourishing, and how do you build structure and infrastructure within a community. We sort of took our work from 2017 as a basis and sent the model to our potential co-authors for these various chapters and said, well, encapsulate it within the context of these marketing systems, the macro marketing, economic, social, and quality of life side. And we got a really good response back. 28 countries are in this book that they have looked, including the United States, but Indigenous authors have analyzed their systems, their activities, and then written within a systematic framework that we provided. So we've kind of, I don't want to say the best of both worlds, but we've tried to provide structure, but at the same time, we told our authors of these chapters, pick whatever you want. What's relevant to you in your community as a country? So within the context of that, we have some tremendous evaluations from places like South Africa, South Korea, China, Indonesia, and even places like Rwanda and Ghana, which don't necessarily have a sort of, oh, you guys should look at that. But in reality, we found that countries that have experience with pandemics, such as Ebola and stuff, generally have a pretty good system structure in place to deal with it again.
Mm-hmm. So I think we've all seen over this last year plus now that this has become as much a political debate as anything else, like everything else, at least in the United States. I'm interested to hear, when you look at the issues that have been debated in this country, wearing a mask, does it help, does it not, social distancing, getting a vaccination just by itself is a question mark in a lot of people's minds. But from your research, what are the interventions that have been administered by public health systems that were deemed most effective in the different countries, the 28 countries that you studied, and did you see differences in those?
Generally what we find is that there is consistency in which ones work, which approaches work and which don't necessarily work. And what we find is that public health system interventions are pretty similar in a lot of places. The question becomes, what role and what intersection is there between government and the actual behaviors and the companies and the population? So that sort of fits in terms of a system interaction that's really important. So if we look at mandates from government that really support what has worked and has been shown to work and what science has shown to work, then there's a very strong element to it. The problem that we have in the U.S. is the public health system infrastructure has been pretty much ignored for a while. So when the pandemic arrived, we saw some of the greatest impact in rural areas, which had pretty much been not paid attention to by health systems as they drew to more profitable urban centers and stuff. So what we see is certain groups in the United States really impacted much more than the percentage of the population they are. For example, in South Carolina, we saw that rural black population made up significantly more of the deaths compared to what they were in the population, almost double.
Wow.
So
it's an interesting observation, and as I think about the question, maybe framing it differently would provide another very interesting result to your study. But so it sounds from what you've said that the common interventions across all countries, they were similar, they had similar outcomes. Was there anything that stood out as a major difference that you identified? Did something work in one country and not in another? And was there a reason for it?
Generally what we find is it's culture will drive compliant behavior or not. If you look at Australia and the US, say, and the UK, we tend to be more independent, and as a consequence, some of these mandates are really resisted. Where if you look at places like South Korea, Japan, cultures which are much, much more collective, so we see a collective perspective on things, they are much more likely to comply with what is the obvious choice when it comes to social distancing, stay in lockdown, do what's right for the society, as compared to what we see in certain countries, including the United States, which we're all familiar with.
So when you think about the effective interventions and how governments across the world, or in this case, the 28 countries that you focused on, evaluated those effective measures, did they pick the right mandates?
Again, it's the marketing answer here. It depends. There is some speculation that some of them didn't work as effectively as they might have thought. Sweden, for example, sort of went to the herd immunity route. We've got Sweden as one of the countries.
Didn't work out well for them.
Didn't work out well. At the same time, the complete lockdowns didn't necessarily work in other countries and caused severe economic impacts as well. One of the good things about having 28 different countries do an analysis internally using our model is that we find, yeah, social distancing works, masks work.
I imagine vaccines work.
Vaccines definitely work, and in the United States, the interesting thing here is that Operation Warp Speed, put in place by the Trump administration, generated 3 top flight vaccines in a very, very short time. And if you compare it to polio vaccines and the number of years that took, we were up and running very, very quickly, but yet the anti-vax stuff that was started in the 1990s to have this hesitancy based on a really bad academic paper, which has been refuted, that there was a tie between autism and measles vaccines. It created this entire attitude about anti-vaxxing. Yet, we have the Republican administration, the Trump administration, put together an unbelievable program, Operation Warp Speed, to end up with vaccines which ultimately, across all these countries that we looked at, vaccination is the bullet.
And if I'm, interpreting what scholars across the world are saying, is that that is the one enormous innovation that's come out, good innovation, that's come out of this entire pandemic, is our ability to now move at warp speed should another pandemic or virus get set loose on the world, that we now have learned and developed technology through the development of vaccines where we can have speed to market, and if we can identify the virus fast enough, that we can get a virus developed fast enough to not have to go through this again.
Yeah, I mean, and really what Operation Warp Speed showed is that some of the newer vaccines and the newer technology, Moderna, Pfizer, and J&J, Johnson & Johnson, I just flew through. Now, Johnson & Johnson is based more on the traditional putting an inert virus into the host, shall we call us. But the other two, you're basically programming the body to be able to respond at the particular virus. Going forward, there's some great opportunities for application of this into other areas, including a bunch of diseases. So we shall see.
I've heard some researchers say that they believe that we won't have another pandemic because of that very innovation. The pharmaceutical industry's ability now, through the research and the technology that's been developed to identify and develop those vaccines so quickly, that some say we won't have another global pandemic for that very fact.
And that would be great if we had a compliant society that wishes to be societal and collective in their perspectives. The difficulty, as many of us have run into in traveling around the U.S., flying around the U.S., it's that there's a group that, again, is against this idea of vaccines. And the anti-vax movement has really damaged, and misinformation, disinformation. We're in the middle of an infodemic, right in the middle of a pandemic. And that infodemic, the World Health Organization basically sees that as a major threat to the suppression and eradication of this pandemic and future pandemics.
So if I interpret what you're saying, you feel that the infodemic and the spread of misinformation poses more threat to our society than perhaps the spread of another virus, which could at least more quickly be identified and cured through a vaccine.
Yeah, pretty much what you have to have for the vaccine to work is a compliant and collectivist perspective on the value of your vaccination to save the lives of your family, children, and contribute to the economic well-being of your nation. And as you know, we are not necessarily seeing that similar view across certain portions of the United States population.
So here's another interesting question that I think your book covers. So we've, again, in this country, the United States, seen this divide over this question of what are the interventions that we need to pursue as a society, what interventions should the government mandate, and we have some freedom, state by state in this country, that allows business entities to pick their own sets of interventions that, barring the things that the government has mandated. So a key question here that hopefully your research has addressed: are there differences between what businesses chose as intervention methods that may have been more or less effective than the things the government was mandating?
Generally, what you find is businesses follow the science. If you want to run numbers, business is really good at running numbers. And generally what you can do is track that with data analytics of what works, what doesn't. The restaurant industry and others have been really damaged by the lockdowns and such. But at the same time, the science clearly pointed that in close proximity without masking was going to create really bad situations for the businesses themselves. What we also have here in the United States and a couple other countries around the world is our federalist system, which our forefathers, founding fathers gave us. But the federalist system allows states to pretty much operate almost in independence from the federal government when it comes to certain mandates or certain putting things in place. And as a consequence, you had certain states, let's say Florida, that were raging when it came to infection numbers because of mandates that were either put in place or not put in place. What we do see, though, is the larger companies almost want to use the mandates that come from the top, the federal government, not the state government. It gives them the ability to tell their employees, guys, you got to get vaccinated. We cannot afford to be shut down. And if you talk to some of these large firms, it's extremely difficult to plan when you've got, a major outbreak. And so you start to see the companies go, this is great that you've given us kind of the cover. So if I'm looking at airlines, if I'm looking at sports teams, and Kylie Irving, I'll just say a thing that we see in the NBA, you can't practice with the team and you can't play in the games.
And that, I think, is a huge paradigm shift for American business. And if I draw an insight into what you just talked about, the difference in government intervention, successful interventions versus private sector, is the difference between profit motive in the business world and allowing politics to creep into science and to dictate public policy, where business had one singular objective, which is how do we get through this, how do we make money, how do we sustain and be profitable? And that wasn't government's goal.
No, but in the same way, what we're seeing is the catalytic institutions in the United States, the governments, but also the business and the non-government organizations. Ultimately, what they hope to do is profit, but the idea of there are more shareholders and, shall we call them, stakeholders that businesses are now starting to recognize as being extremely important, that it's not just maximize profits, it's contribute to sustainability of your company long term. And that means that you have to start thinking about all the stakeholders. And you see in Gen Z and the later part of the millennials, a real awareness about who's contributing to society and who's not. So you see a lot of companies now looking beyond stockholders in terms of performance. It's the stakeholders.
So Don, we talked about the health policy interventions, the mandates from the private sector, from the government sector. Those are all ultimately around health policy and trying to quell the spread of the pandemic. And your book covers a lot of the ground that 28 countries covered in trying to identify what those are, what's most effective. But if we shift gears for a second and pick up on what we were just talking about, did you see differences in how government intervention affected the economic and social well-being of their countries?
Yeah, definitely. But we also saw different strategies from different countries and different regions of countries, the U.S. I'll say. But in places like Brazil or some of the other, what used to be called developing economies, which I think in today's world is a bit of a misnomer. But we see that government and legislation really impacted in positive ways in a lot of places. And when you think of economies being strong, portfolios in the United States in stock markets and stuff did really well during the pandemic. We're talking about enhancing your net worth significantly, multiple double-digit type of stuff. But at the same time, the working class, shall we call them, or
vested in the equities
not
market.
vested in the equities market, I can't go to work, and how am I going to survive? And if I didn't get some sort of relief from the government to allow me to stay in my home, allow me to feed my children, it would be disastrous. And if you go around the world, there's a lot of places where it got really tough. And the interesting thing is that you had government, NGOs, non-government organizations, and religious organizations, and neighborhood coalitions and individuals step up. So in some of these really hard-hit areas in Brazil, for example, neighborhoods got together and cared for those that were at real risk of starving. And you see here in the U.S. some of the religious organizations and community organizations and NGOs starting up food banks, etc. I just was speaking with a friend of mine who's in Cambodia, and she said that nobody's got jobs in Cambodia because of the pandemic. Blew up tourism really bad, but she has been running food banks for a great number of people there. What we also see is sort of healthcare stepping up, not charging, and we see this in the United States, we see it in a lot of the developed world too, checks being sent directly to those at risk. So tax regulations being changed, educational and child stipends. So some things that really help bring things into perspective, and things like free COVID testing, those have really helped. What we tend to see in some other countries put a little different spin on things as compared to the US, but at the same time, there is this sort of your neighbors stepping up and helping you out. So private landlords stepping up, and not necessarily at the direction of the mandate from a government, although that happened too. They just would say, okay, you owe me later, and we'll take care of that. Utility companies, the same thing. They say, okay, we'll keep the books open on you, and we're not going to turn out your power in the middle of a pandemic. So,
and that has the downstream effect when that bill comes due, which it will.
Yes.
How are people going to scrape that money together? So that's a key question here. Is you talked about huge gains in the equities market. Is the give back going to come?
It's hopeful. I mean, the problem that sometimes we run into is we do forget the middle class. And so I think in some of the legislation here in the U.S. and around the world that we looked at, there's been a step up to try and provide long-term support in some of these areas. The impact of the pandemic, though, is going to go on for quite a while. In speaking with my friends in ICUs, I have several friends in the intensive care units, nurses and doctors. They're exhausted. And when this big surge hit with the unvaccinated, you're talking about 98% of the people that are in the ICUs in distress, on ventilators and stuff, are unvaccinated. So you want to talk about the economic impact of unvaccinated people. The drawdown on healthcare is ungodly. Now, at the same time, long term, a number of the healthcare employees that I know, nurses, doctors, and technicians, they're done. And they're pretty much saying, I'm retiring next year. And they thought this would be something that they had stepped over, but this most recent surge, they're burned out. And so imagine having to work double shifts over and over and over again in shortages so that you cannot escape. They are very, very tired, and that's another total down the road impact, is how are we going to respond. And the same I've heard from some of my teaching friends. The last couple years for teachers have been just, so demanding and so, difficult. And especially when we see some of the caregivers who were being heroes being attacked, grocery stores wearing their scrubs because someone accuses them of spreading COVID lies.
That's one of the most amazing things to me when I witnessed the evolution of this pandemic, is in the early stages, the healthcare workers were acknowledged as heroes of our community. And we went from that to now berating the people who have literally put their lives on the line to help others get through this. And that is a revelation that I suspect when we all look back at this, a lot of people are going to be pretty ashamed of.
I hope so. I hope that there's a recognition that, and again, friends of mine and actually family members as well, get up every morning, go in and battle for 12 hours, and then stop at a at a 7-Eleven or wherever it might be just to get some food to get home and take care of their own families, and they're being berated. And they, quite literally, a lot of counseling going on, and the health system, the mental health system is also stressed to no end. And if you look at some of the numbers on the mental health, it's going through the roof too.
Well, one of the things that I think gets repeated through this is that the revelation that the pandemic hasn't changed history, it's expedited its velocity. And I can only hope that's true in the sense that the political rancor that's taken over our common sense views of public health policy, the debate over simple things like wearing a mask or is a vaccine effective, that if that statement is true, that it's helped us expedite the velocity through those issues and get to a common base of understanding of how we can prevent this from happening again.
We definitely need to understand how the system works, because everything is interconnected. And again, back to this idea of a macro marketing or a macroeconomic approach. All the systems interface. So if I'm burning out my healthcare workers, down the road, that's going to cause systematic impact in other spaces. At the same time, your comment on acceleration, absolutely true. So if you look at the acceleration that came out of the Spanish flu, the 1918 H1N1, the world changed significantly. There were tipping points. There are things where things go on. You go back to the Black Plague, the same kind of accelerant occurred there. So what you're seeing is something that has happened in history before, but at the same time, we're dealing in an organizationally and systematically connected supply chain. And all we got to do is go down to Long Beach to see some of the problems that are there. But again, this is all connected. It's a system that we operate in, a global system, whether you want to say it's global or not, it is. Everything is connected. At the same time, we're seeing politics across the world start to rise up and things too. And so tend to draw on quotes from history because I was a history major as an undergraduate. I'll say it was in the last century. But Euripides from the Greeks, his quote, and I've actually got it in the book, is, "Nothing has more strength than dire necessity." And that's where we are.
And that is a great way to close. Don, the name of the book is Community, Economy, and COVID-19, Lessons from Multi-Country Analysis of a Global Pandemic. I want to thank William & Mary Professor Don Rahtz and his co-authors, Clifford, Shultz, and Joseph Sirgy, and just appreciate the comments. We're excited for the book to come out. When's it coming out?
We are delivering it hopefully November 1st, and then it'll go into production probably within a month after that. So after the first of the year.
Well, we can't wait for it to hit the bookshelf. And again, thanks for your time, and good luck with the book.
Appreciate it. Thank you.